So, good morning, friends. Today, we are going to understand what is borderline personality disorder. In psychiatric conditions, why this borderline personality disorder matters, why, or we will understand what is this borderline personality disorder is, what are the different other personality disorders, why this is important when it comes to even our clinical practice. In our today's talk, we will see what is borderline personality disorder, what are the root causes and risk factors associated with it, the living and persons who are living with this borderline personality, the person who have a different type of experience from the regular societal norms, and pathway or the recovery to treatment. So, what is borderline personality disorder? So, it is a mental health condition which is marked by significant emotional instability affecting the relationship and self image. The person who is suffering from this sort of personality disorder has mainly two aspects differing, that is, the emotional instability. The person cannot regulate his emotions, because of or due to which what happens is his relationship becomes unstable and his self image also becomes unstable. So because of these experiences of emotional instability and relationship instability and self image, the person with borderline personality suffers. And these kind of patterns or the behavior which is seen in this borderline personality, it differs markedly from cultural expectations. So how a person is expected to live in the society is totally deviated because of the underlying condition. He has multiple issues, and following which he ends up into other psychiatric conditions also. One of the diagnostic criteria, that is emotional and relationship instability, that is the very important one. This includes avoid abandonment. The person is unable to have a stable relationship, so because of which he may end up into multiple like unstable relation, which might end up, if married, into divorce, or the person is not able to have a healthy relationship with his peers and his professional also. And he might have the intense anger issues are very much, and feeling of chronic emptiness. The person never feels as happy, never feels like he is full. So because of which the instability surrounds. You might have seen the people, like in your work or your home or in your neighboring or in your professional life, they are one who are having very frequent issues when it comes to relationship. And when the anger it comes, the becomes unstable, and the persons are never satisfied. So these persons who are surrounding around you are might be the one who are suffering from borderline personality disorder. And the behavioral and self identity issues, what are these behavioral and self identity issues? This becomes covers impulsivity, even the suicidal behaviors are there. The person with borderline personality may have the multiple cuts are there. When you see his hand, there are multiple cuts around. And identity disturbance, he may not be have a stable identity, he may feel underconfidence, and because of which multiple stressors, he may even become paranoid, like people are not accepting, having multiple thoughts which are confusing, and having an ultimately identity crisis. And even dissociation is one of the frequent disorder which is associated with the borderline personality disorder. So dissociation is another topic for further. So this borderline personality disorder is very common among the females, and this are something in our professional or in our day-to-day life are called as attention seeking behavior. This attention seeking is something which is causing a lot of attention seeking, is something which is commonly seen among these people who are suffering from this borderline personality. But the reality is entirely different. The inner side, the as a doctor side, the reality differs. So what are the root causes and risk factors for person to develop borderline personality? So when it comes to the biological function, that is differences in the brain and controlling emotions, the amygdala is one. in our brain. The amygdala is one of the structure in our brain which is very important and helps in controlling or regulating our emotions, and the prefrontal cortex which have an impact on the behavior. So dysregulation of amygdala and prefrontal cortex, so neurochemical imbalance is seen in among these two structures which lead to the contribution of borderline personality. So hereditary and genetic links. The person who are suffering from this borderline personality, mainly having a close family member or a parent or a person or a sibling, might be having a borderline personality, along with following which the person might develop due to it. So other causes include childhood trauma, mainly the early life stress, that is the abuse, the neglect, or the suppression of the parents is one of again the important risk factor for developing borderline personality. Invalidating environments. Growing in a family where feelings and emotions are consistently dismissed. The child doesn't feel like he is emotionally valid, his emotions are valid. Always the emotions need to be addressed. Otherwise, the child doesn't have an emotional regulation. Following which, the when the child grows, leads to the contribute or leads to the development of emotional dysregulation, and this emotional dysregulation is one of the cause for borderline personality. So the person who are suffering from this borderline personality, they are the one having with multiple mental health issues, namely the depression, anxiety, which is very common among the people, and the substance use disorders. The person who are suffering from other kind of substance use, like namely the cannabis, alcohol, or any other sort of substance abuse, leading these are the one having might have the comorbid borderline personality. So people who are suffering from borderline personality have multiple other diagnoses, leading to the complications and difficulty in treatment, and also having an outcome which is not good as the person who is not having borderline personality. So living experiences, so managing intense emotions, the person need have multiple like sudden outburst of anger, rapid mood swings, sometimes he is happy, sometimes he is wrong, impacting daily life and decision makings. So his daily life is difficult and his mood is unstable, leading to the decision is also dysfunctional. Navigating work and educations. Difficulty in maintaining stable performance in professional and academic setting due to emotional instability and interpersonal issues. So stable professional relationship, as I have talked, leading to emotional instability, and the person who is having this borderline personality have the issue with others and leading to the interpersonal issues. He may have difficulty in communicating with his bosses or his peers or colleagues. So fear of abandoned dynamics. An intense, often overwhelming fear of left alone can be lead to frenetic effort to avoid real and imagined separation. So the people have chronic emptiness, following which they also feel like some they might be abandoned, they might be social abandonment might be there, due to which these people have always a fear of separation, but which is not real, and leading to de-evaluation, that is extreme ideas, all good or bad, perception shifting very quickly. Sometimes they feel that it is good, sometimes they feel it is very bad. So perception really shifts. So crawling and feelingness, unstable self-image and identity. So leading to frequent changes in the goal, values, and career. So goal suddenly changes, values suddenly changes, career affects, and personal identity affects. So this is the reason the borderline personality is important and need to be addressed. And due to the risk of self-harm, impulsive self-harm, these people and substance abuse, these people needs to be treated. So one is, so coming to the management, that is the treatment aspect include the dialectical behavioral therapy. The person need to be addressed to manage his emotions, handle stress, improve relationships, and he needs some sort of therapies which are focused on treating his emotions and self-identity. And even sometimes medications are required when there is comorbid depression, anxiety, and any other regular meditation or deep breathing, and even difficulty in managing emotions, then this also needs to be addressed. So when it comes to the borderline personality, so we have to address, otherwise the person will have issues in his professional and personal life, leading to fear of abandonment. And a supportive care is very much important when it comes to treatment aspect, in order to have a stable recovery. and joining the group of similar people who have similar kind of experiences, sharing their advice and mutual encouragement is one of the important step having to have a good outcome of borderline personality disorder. Thank you one and all.